Let's pick up, Doctor, from that particular point.
Okay, yeah, at the end of the last segment, I was mentioning how I think as a result of people living longer and healthier, that it's very important for medical doctors and for people who are seeing them going into annual physical checkups, might be having certain types of ailments, to be very mindful that they have to really be aware that the demographics are changing and that people are living longer, that they are wanting to live healthier lives, they are going to the YMCA, staying in shape. So we might have this stereotype in our minds that wants to kind of mold people of a certain age in a particular category, but people who are eating healthy, exercising, doing the right things they're supposed to do, might be on one or two medications, but overall living well, have this interest in wanting to have a good quality of life over the entire life course, and very interested in doing some of the same things they did as if they were 20 years younger. So we're living in that type of a generation right now. However, as we do look at the African American experience, the statistics indicate very strongly that the chronic illnesses are still disproportionate. So I would love our audience to understand that we really need to be mindful about certain habits that we could be preventive. Overweight and obesity is still a very prevalent issue within the African American community. It would be really nice if one would start earlier thinking in terms of being in the right weight size, your BMI, your body mass to muscle mass, that ratio be consistent and on the average with where it should be. Most of it comes from something that's simple, just eating correctly and exercising. Now, when one goes to the medical doctor and they try to share with, say, a person, you need to reduce some weight, and then you go back the next time and they increased it more and more, then you're going to have the onset of high blood pressure, hypertension. So it's very important from a medical sociologist's point of view to try to understand that and just try to do whatever you can to get on balance, to be preventive. I think that's the big key word, to be preventive of health and health care.
You know, the